Thanks for that introduction, Trisha. And my name is Brianna Ralph. I'm joining you today from a balmy Bozeman, Montana. And here I'm going to share a little bit around the research that I have done, as well as the research that a lot of folks on this call have also done to really understand and explore what's happening with families in rural communities across the country. We are looking back at some of the information that we've already been learning, as well as considering what we might look to in the future. I am a faculty member here at Montana State University in Health and Human Development. I'm an assistant professor, and I'm also an extension specialist in food and family. So my research spans both basic science as well as understanding how do we translate this research into meaningful practice. So I'm so excited to get to talk to all of you about this today and to hear your insights too on how do we take this information that we're learning in the research and really translate it into something meaningful and useful to your everyday work as well. So let's dive in to family influence on health behaviors in rural communities. Our objectives for today are to consider why families in rural communities might have the ability to influence health of themselves and others, and to identify current research connections between rural families' health from the Rural Family Speak project that has been occurring over the last 20 plus years, as well as consider some of those food influences in rural communities through a couple of examples that I will share from my work. And then I also, we will be brainstorming how families can help to improve individual, family, and community health and well-being in all of our communities. So let's start. Again, I know that many of you are working in rural communities, so I'm preaching to the choir a little bit here, but why do we think about rural and why should we think about it a little bit differently than we might think about other communities we work with? In considering rural communities, we know that there are health challenges, there are disparities when it comes to the rates of nutrition-related chronic disease, for example. We also know that there are health disparities when it comes to some of our minority and underserved communities, including lower income community members. And this can include higher rates of obesity than even sometimes their urban counterparts, low rates of primary care providers and challenges in accessing some of those healthcare resources, as well as higher rates of substance misuse. We also know that rural communities bring their own strengths with them. So as we think about what some of those strengths might be as they relate to this topic particularly, we think about a strong sense of independence and pride, as well as social capital within that community. We also think about those relationships within that community. You're much more likely to know who your neighbor is and to have some connection with them in rural communities. We also see that rural communities have an even stronger sense of place. So that connection to community, oftentimes as well, this might mean connection to family in that community and use of those community resources to support one another. And so when we think about why rural, we think that they have some unique challenges as well as some of these unique strengths that we can really rely on and build into why we do what we do to support people in these communities. Now, why family? We've talked a little bit about rural. Now, let me sell you on why we should consider families, regardless of the work that we're doing when we're working in rural communities. So when we think about Bowen's family systems theory, I'm going to get a little theory on you here for a moment. We think about some central tenets of that theory. We think about that family is self-determined. You determine who is in your family, whether that's blood relation or kin family that are really those supportive caregivers in your community as well. And so determining who is your family and who is connected within your family is a really important thing that we all determine for ourselves. Sometimes there are relatively traditional definitions of what that family looks like, and that might be how you view your family, but sometimes it's a little bit of a different definition, and that's okay. Whoever you're determining is within your family can be that family support system. We also know that families are complex. They work together and sometimes they work against each other in supportive and challenging ways. But we also see that families, as they work together, are trying to find an equilibrium, a space where you can not have too much tension, but you are then providing support in a way that is supportive to all, kind of finding that, that space where all needs are met together. We also see that there are bidirectional supports within family systems. So this might mean, for example, that a parent is supportive of their child, but similarly, that child might be supportive of a parent. We also see that happening beyond just two people. So it might be three people in that system that are interconnected and providing supports in different directions so that if you are a three-legged stool, you can still stand. And family really is one of those central tools for how we function day to day, whether it's your work family, your home family, or your larger extended family that might be in your community as well. So what we found in the research is that these tenets of thinking about family systems and how they function are really true, and it's playing out in our health behaviors and our health outcomes. We found, and these studies are all cited from research that has been done within our Rural Family Speak team. Most of these are relatively recent citations from our more recent data collection since 2012, 2014, talking to low-income mothers in rural communities across the United States. And in that, we learned that household food and physical activity, this would be anyone in the home and what behaviors are happening there, is associated with mental health. We also see that some of these depressive symptoms are also associated with other family members' ability to work consistently. So then that's impacting economics. You see mental health potentially impacting economics, and physical health and food impacting mental health. We also see high rates of food insecurity. So that's a household challenge. It's also often indicative of challenges within the community that they might be facing in terms of access, affordability, quality, and that people in these rural communities are often faced with these challenges when trying to navigate how do I keep my family healthy and fed. Also, you might find a number of these examples are food related, as that's the background that I bring to this as well. But food parenting strategies, we see some of these lifelong habits. So how parents and caregivers interact with each other and with children in the home around food is something that can be passed on across generations. We see that those caregiver childhood experiences, so what happened to that parent or caregiver in their own childhood, influences their interactions in present day, especially around health. When we think of what did I do in my childhood that I really want to carry on and keep strong, or what did I do in my childhood that I don't want to repeat? In either direction, we see those childhood experiences really influencing how caregivers are then parenting themselves and the decisions that they make around those caregiving practices. And we also see that social supports and positive relationships may reduce depressive symptoms. So some of these challenges lead to more challenges, while other times we find some supports within this family system that might alleviate or address some of the health challenges being experienced. So there you see the bidirectional nature. The one thing that I will also point out when we're thinking about particularly the first point here of household food insecurity and physical activity connected to mental health, household food and physical activity connected to mental health, that we see these associations happening bidirectionally, not only in this research, but in other research as well, that mental health is definitely connected to physical health. And here we're seeing that household physical health is also connected to maybe an individual, in this case, a mother's mental health as well. So I wanted to share an example, some of the work that I do in talking to professionals all across Montana. Oftentimes they are working in areas of food, but not always, is I like to ask them to consider a really positive food experience. So I'll ask you to do the same. Take a moment and think about a really positive food experience that you've had in your life and consider who was there, what did you smell, what did you see, what did you feel about that experience. And as you're considering that, you've had a little bit of prompting to consider what I might be trying to look at here. But even without prompting, almost every single one of you will have thought about family or friends in relation to that food. So you think about yourself in this situation. You're considering this food experience. Myself, I was there. You were inherently at this food experience. You had your own perceptions around what was occurring and how it was occurring. But also, you might consider that this self-experience that you had with food relates to past experiences. Was it a family tradition that was continued on and that family tradition was really meaningful to you? Was it something current or future related? Were you thinking about how this brings family together right now in a time when we've just had a lot of time apart from one another, and that current component is really influential, or thinking to the future around how maybe that most meaningful food experience was connected to things you're hoping for the future and why you might eat those foods that you eat. We often find that people are thinking about all of these things, but not necessarily considering all of the factors that are related to family and how they're related to family. So they might be thinking about how they were raised. You might be thinking about how you were raised, how your parents or caregivers interacted with you around foods. You might be thinking about sibling interactions that you had or maybe supported growing up in different food influences. Grandparents, kin, relative kin or not, fictive kin as well. You might also be thinking about how do your food choices influence that of your own children or that of future generations, your grandchildren, also considering that what you are eating today is influencing people into the future and providing those present day experiences for people to come back and consider as well. And so I share this because as we think about what influences our food choices, oftentimes, whether or not we're identifying it, family is involved. Whether they're a support, a detractor, a challenge, or a benefit in that situation, food and family are really intrinsically interconnected. But it's not just food that family plays a role in. It can be all sorts of health behaviors. Have you seen people in your home modeling physical activity, for example? What kind of discussions have you had about substance misuse within your family together to make family-related plans, have family communication around those topics? And so as we consider that whether or not we want it to be, family is a part of our experience, our motivators, our challenges, in carrying out these behaviors because either we live in the same home with them or those past experiences are influencing and shaping why we do the things that we do and our perspectives. Those family members are important to consider when we're providing outreach and trying to address or improve different health behaviors. So we want to really build on family and consider whether our work relates to family directly or not. Can we bring in and build on those family connections? This means, can we consider family as a motivator or a support within this situation? If perhaps a participant is not viewing them as a motivator or support, why not? And maybe that in itself can be flipped around to consider how could they be in the future? What would that look like to that participant? So considering those opportunities for bringing in those family members to provide more connection, more opportunity for clarifying future challenges that you might encounter and seeing if you can alleviate some of those challenges that might occur with family or really pull on that family for support in behavior change. We know that behavior change, while it can happen at an individual level, is really best when it has some sort of support, some sort of peer support system. And what better peer support system than those that you are already living with? So I wanted to share a couple of ideas that folks in extension services across the country have been trying and incorporating into a variety of health-related programming. And then we will break into some smaller breakout rooms to hear what your ideas are, if you've tried any of these strategies, if you have any other strategies that you might consider for how to engage family members. One of the first ideas for engaging family members is to engage them directly. Bring multiple family members together into the same conversation, whether that's a large group or a small individual family conversation, to have them interact and identify what are those motivators, what are those past experiences or current or future goals that they might have that are shared and that they could support together. If you only have one family member, that's okay. We are all members of some sort of family, whether it is a traditional definition or something that we've defined on our own. Prompt individuals to consider those family members and other relationships that might be support or challenge to those health behaviors. See if they can identify strategies or ways that they might engage their family members or lean on them for that support. You can also review the language in your resources. When we are providing information to individuals, they are also still members of a family. Can we provide some language that encourages them to consider family members, whether that be folks living in the same home with them or extended family generations as well, past or previous family experiences too. So look at that language to see, are you inviting family into the conversation? And you might also consider that household context in setting goals. I know that a lot of our work around behavior change and supporting health of others has a lot to do with setting those small, manageable goals. But that also means that sometimes people don't initially recognize the role that family plays in their ability to carry out a goal. And so prompting them to consider that household family context as they're thinking about their goal. Will it make it more challenging? Will it make it more successful? Do they have a way to share that with a family member to improve accountability? Do they have a way to invite a family member to take part in that change with them? So considering that household context and prompting them to consider that household context can be another strategy for how we might engage families in promoting healthy behavior change. I think that this topic and the engagement of family can really apply across all areas. I've particularly found it relevant when thinking about food and nutrition. And I think that we always have opportunities for expanding or considering new ways to engage family. It doesn't have to look all the same all of the time. But I also hope that today in our breakout room conversations, we can learn a little bit more from one another around what are those strategies that have worked for you? What challenges have you run into in engaging families in outreach? And what ideas do you have for the future after considering a little bit more how families might be working together? So thank you all for coming and sharing your time with us this afternoon. I hope that you had some really interesting and engaging discussion and that you're thinking about how you might have a few new strategies to engage families in your communities, in your research, in your outreach, so that we can really work together to make that healthy choice the easy choice with household supports.